The Trump administration is warning the U.S. that April will be an especially rough month regarding coronavirus cases. Officials say social distancing is helping slow the spread of the disease. But should people start to wear masks too? Opinions differ. John Lawrence reports.
Slovakia, Austria, and the Czech Republic now require everyone to wear a mask in public to help contain the spread of the coronavirus. Even the president of Slovakia wears one when hosting official events. It's something U.S. officials are talking about.
Getting a much more broad, community-wide use of masks outside of the healthcare setting is under very active discussion.
But Dr. Fauci stresses he doesn't want this to affect mask supplies for hospitals across the country.
You can use something else over your face. It doesn't have to be a mask. But it's not a bad idea, at least for a period of time. I mean, eventually you're not going to want to do that. You're not going to have to do that. This is going to be gone.
As the White House and the CDC discuss the issue, the World Health Organization recommends only people who are sick or taking care of someone who's sick should wear masks.
There is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite.
There were at least 830 deaths from COVID-19 reported on Tuesday in the U.S., and the Trump administration says the pandemic's threat has yet to peak.
This is going to be a rough 2-week period. As a nation, we face a difficult few weeks as we approach that really important day when we're going to see things get better.
I'm John Lawrence reporting.